You trust your doctors and follow their guidance. But what happens when they're not on the same page about your care? It's confusing, stressful, and it can leave patients feeling stuck. Dr. Ray, you've been on both sides of this as a doctor and as a caregiver. What should patients do when they're caught in the middle?
Well, first of all, they need to have an honest conversation with their physician, and the physician needs to outline not only what they're saying, but why. Tends to be a why and the reasoning on what they're thinking. And so you have to remember nowadays, it's a partnership. Do not accept somebody just telling you something. They need to tell you why, and there has to be a thought process with it. And so that conversation has to take place. Also, bring somebody else with you to have another set of ears, and then write down and have your own set of questions. Sometimes you may have to have a repeat visit because you need to think about the things that you are being told so that you can research those and then come back. But the other thing is physicians, you have a primary care doctor and they may send you to a specialist. That specialist is a referral. That referral will send back to that doctor, letting them know what they are finding. And you can also have the doctors to talk.
Right, but what happens if both of them have such differing opinions that one of them saying, yes, do this treatment, and the other one saying, absolutely not? And who do you go with? And I think that's when it's really super confusing,
But I think
because
you
the
make them
cardiologist...
tell you why.
Oh, I completely agree. Tell me why. But if the cardiologist is telling me this and the primary care is telling me this, who do you listen to at that point?
Well, I think if it's my heart, I'm probably going to listen to my cardiologist.
Okay.
And that's where you draw the line. It's like, don't refer to a specialist and then you're not going to listen to what they say. They are the specialists. So you have to give them some credit because that's all that they're studying on. But also, they need to tell you, if I do this, how is that going to change my outcome or my treatment, or is it not going to? So we have to know exactly why are we doing what we're doing.
I remember having a friend of mine in the hospital, and this goes to what you're saying and also what you're saying, and he had an infected toe. And the surgeon wanted to remove the toe, and his podiatrist thought he should wait. And he slowed it down for about 24 hours and decided to do the more conservative thing and leave and not have his toe removed. But it was very stressful. And both doctors were very respected and very listened to, but it was a hard situation to manage.
On that situation there, I see the podiatrist saying, I understand the dynamics of what happens when you lose that toe. And I see the surgeon saying, I understand what happens if that infection continues to spread. And so
how can we bridge that gap?
You could always slow things down for yourself or when you're advocating and say, we're really confused because we're hearing this and we're hearing this from these different sources. Can you confer and decide what the
other
recommendation
thing is? Go get a third opinion.
Yeah.
It's okay.
Yeah.
Put the plan in place, listen to what's going on, ask your questions, and always ask your doctors to talk to each other. We do it all the time.
Yeah.
We do it all the time.